oral cancer is a malignancy that starts from the epithelial lining of the oral cavity or oropharynx, which is the back of the mouth, beginning of the throat. Now, depending on the anatomical area you're talking about, the signs and symptoms would be a little bit different. For example, in the oral cavity, which is readily examinable. That's an area that the dentist can access and they can look at. Sometimes you find a non-healing ulcer, an ulcer that doesn't go away and persist. Initially it's painless, but then gradually, it can become painful. Sometimes we see a red patch or a white patch that, again, persists and does not go away. Sometimes it becomes thicker and indurated. If the problem persists, sometimes the cancer becomes infiltrative and the patient may not be able to move the oral tissues. Like, for example, the tongue becomes fixed and immobile. But these are really, really late signs, and these are not good. Sometimes patients says, I cannot put my denture in because the alveolar ridges, the place that the denture sits on, has expanded, has gotten bigger or swollen. The patient cannot put that in, or they have difficulty talking or speaking or performing oral functions. These are usually late signs, and that applies to oral cavity cancer. Now, the oropharyngeal cancer is the cancer in the back of the mouth and beginning of the throat. It has a slightly different type of signs and symptoms. The patients may complain of having a lump in the throat, or they have hoarseness of the voice. Sometimes they have hemoptysis when they cough, they bring up blood. Sometimes they have earache. I have had patients who came into the dental school thinking that they have a toothache that is radiating to their ear. That's the first thing patients think about. And we examined, there was nothing wrong with the tooth. And when we looked, we inspected, I could see the beginning of a mass in the throat. That's all I could see, because you have to scope the patient. We sent the patient to the ear, nose, throat doctor, and lo and behold, the cancer was in the throat. It was so advanced, infiltrated the nerves, and the patient was getting an ipsilateral pain, assuming that it's coming from the tooth. So smoking is one of the most common risk factors for oral cavity cancer. For the oropharyngeal cancers or cancer of the throat, it accounts for about 30% of cases. But still, it's a risk factor, and we educate the patients about what they should do, what they should avoid. And in both cases, in the cancer of both anatomical regions, if the cancer is not attended to, if it's not discovered in a timely manner, it will have time to spread. And where it spreads to is the neck. It goes to the neck lymph node, and sometimes you see a swelling in the neck. Lymph nodes get bigger, and it's not a good sign. That means that now you have a more advanced type of cancer, more aggressive treatment is needed, and those nodes are hard, fixed, not movable, bad news for the patient. In both cases, it can happen with long-standing lesions.